A 55 years old man from the Hong Kong, present with left-sided watalgia and recurrent episode of the epistaxis. That means the earache and epistaxis. On examination, pharynx appears normal. That means there is no pathology in the pharynx. Examination of the neck reveals left-sided cervical lymphadenopathy. So what is your diagnosis? Here are the options. Options are enteroconal polyp, nasopharyngeal carcinoma, adenocarcinoma of the tonsil, angiofibroma, and globus syndrome. So here, first of all, let's see the patient from the Hong Kong present with watalgia, that means the earache, and also the epistaxis, then the bleeding through nose. Also, there is the left-sided lymphadenopathy. Left-sided lymphadenopathy, that means the lymphatic metastasis. That means it is one type of the carcinoma. So go for the carcinoma here: nasopharyngeal carcinoma, adenocarcinoma of the tonsil, and globus syndrome. These are benign. So only nasopharyngeal carcinoma or adenocarcinoma of the tonsil. Let's see. First of all, the nasopharyngeal carcinoma. In case of nasopharyngeal carcinoma, it is the squamous cell carcinoma of the nasopharynx. It is the nasopharynx. It is rare most of the part of the world apart from the southern China and the patient from the Hong Kong. So there is a chance of development of the nasopharyngeal carcinoma, and it is usually associated with Epstein-Barr virus. Now see the clinical feature of the nasopharyngeal carcinoma. So the presentation on the local, there is the watalgia, that means earache. In this patient, there is earache present. Unilateral serous otitis media may develop. Nasal obstruction, discharge, also sometimes epistaxis, which is present in this patient. So watalgia and epistaxis is present. Also there is cervical lymphadenopathy. So these three features are present in the question. And cranial nerve involvement, cranial nerve 3 to 6 may be involved by this virus. So watalgia, unilateral otitis media may develop. Nasal obstruction, discharge or epistaxis, cranial nerve pulses from the 3 to 6, and cervical lymphadenopathy. They are the clinical feature of the Epstein-Barr virus infection, which is the nasopharyngeal carcinoma. And in case of the nasopharyngeal carcinoma, the imaging by the CT scan and the MRI. CT scan, it is very useful for bony lesion and bony landmark, and in MRI is always very important for the soft tissue. So for the soft tissue, MRI; for the hard tissue, CT scan. But this CT scan can also demonstrate the soft tissue. MRI can also demonstrate the bones. So CT and MRI combined image, it is very helpful for the nasopharyngeal carcinoma. And the treatment first line treatment option is the radiotherapy. So it is in short about the nasopharyngeal carcinoma. The nasopharyngeal carcinoma, it is caused by the Epstein-Barr virus infection, and the common presentation is the watalgia, epistaxis, cervical lymphadenopathy, and also here we can see some other, which is the otitis media unilateral. Nasal obstruction may develop and discharge may develop. So what is it? It is the nasopharyngeal carcinoma. Why nasopharyngeal carcinoma? The clinical feature is the watalgia and recurrence episode of the epistaxis. On the other hand, another important clue that patient live in southern China in the Hong Kong. And also there is the cervical lymphadenopathy. In nasopharyngeal carcinoma, there is cervical lymphadenopathy developed. So our answer is the nasopharyngeal